Hello, I'm Natalie Kunsman, MD, and if there ever was a topic we were going to discuss that is completely prototypical of the mind, soul, body connection, it is the topic of anxiety. So anxiety is a mood state that's characterized by worry, apprehension, and it also has somatic symptoms, and somatic symptoms means physical symptoms that the body can feel. And there are so many types. There's generalized anxiety, there's situational anxiety, there's some illness-associated anxiety, social anxiety, phobias of so many varieties, and I'll give a few examples such as agoraphobia, arachnophobia, fear of illness, fear of heights, fear of flying, fear of animals. Then there is the panic disorder, there's unspecified anxiety, and of course PTSD. So let's get right down into the treatments of anxieties. So I'll start with medications, which are one of the biggest reasons people will come to see me as a physician, but I also wholeheartedly subscribe to the integrative approach so that medications do not stand alone. So the gold standard, or the first line of treatment, is an SSRI, which is a serotonin reuptake inhibitor. And as the name implies in its mechanism, it is trying to allow serotonin to stay within the synapse much longer. Some of the common names are Paxil, Prozac, Lexapro, Zoloft, and several others. Now, going with that may be a whole host of side effects, which might be some sexual disturbances, weight gain, sleep disturbances, and a whole host of others. So we also have SNRIs, which are serotonin norepinephrine reuptake inhibitors, and one of the common ones is Effexor. Effexor also, again, works on noradrenaline, so that may help with concentration and alertness a little bit more so than the SSRIs by themselves. Then we have the benzodiazepine category, and some of the common trade names for this is Valium, lorazepam, Xanax, and they exert their influence in a much more different capacity than an SSRI. They promote relaxation by diminishing muscle tension, and they are great to abort a panic attack. They should not be used on a consistent every single day basis because they are very habituating. And for instance, if you use them early on today, several weeks, months, years down the road, they may not be efficacious, but they do work well to abort a as needed basis, and for instance, use prior to a flight, use prior to a funeral, aborting a panic attack. There are atypical medications that don't really fall into any particular category, and they are used very commonly by me: Buspar, hydroxyzine, which winds up being in one of the antihistamine families, and beta blockers. Beta blockers will go right to the root cause of settling down the heart rate response and the cardiovascular manifestations of anxiety. We have tricyclics, which are nortriptyline and amitriptyline, and there is a whole host of side effects that may go on with that, such as dry mouth, sedation, which sometimes is the desired effect. Sometimes ocular pressures or glaucoma needs to be considered with this, as well as some cardiovascular related issues. Now we have a new player that also must be used with caution and is not something that I typically have in my quiver, which is ketamine. And that is getting some FDA approval, but there is a lot of caution to be used with this. And while we are on the topic of caution, I need to give a word of caution to cannabis. So there is a lot of relaxation with the CBD component of cannabis, and that may be fine, but smoking, which will now incorporate the THC component, may promote a lower dopamine and trigger psychosis in those people who are predisposed for this. So let's move on to some herbal remedies that may help, especially if the condition is not as severe as when medications are warranted. So we have L-theanine, which comes from the green tea family. GABA, which is a relaxant that is secreted by our brain and our nerves, that is secreted in our calming fashion. We can actually supplement with an herbal remedy for that. Passion flower. And we have some Ayurvedic herbs that are starting to gain a little bit more research, which is Bacopa. And ashwagandha is used very frequently, especially if we are trying to treat adrenal health, as it is an adrenal adaptogen, which may help quiet the adrenal gland with its cortisol response. And many times that'll get piggybacked with some good B complex vitamins, as well as magnesium, which is also a natural relaxant, and all of our cells will use that. Keep in mind that L-tryptophan, which we discussed previously, is one of the amino acid constructs from the protein family, which is what is needed to make serotonin, which is what is one of the biggest chemistries governing the anxiety and the depressive response. So that was the medication response. And many times medication is needed when the condition warrants it, but also should have adjunctive treatments, because again, we are a soul living in a human body, so that we need to take care of our soul, our brain, as well as our bodies. So in walks cognitive behavioral therapy. And the cognitive component is how the thoughts, not external events, but how those thoughts are actually contributing to anxiety. And it's not necessarily the situation that causes the anxiety, but our or your perception of the situation that warrants the anxiety. And a lot of us can take the same situation, and depending how we think about it, can either allow us to get through it, be resilient to it, or become anxiety stricken from it. So many times we would like to piggyback behavioral therapy to get into how we may behave or react in these situations that will trigger the anxiety. So we need to identify the thoughts, replace the negative thoughts so that we may be thinking about the pros and the cons about worrying or avoiding. And then we want to replace those thoughts with new ones that are accurate and positive. So we can also do an exposure therapy to almost create imagery of these scary situations to almost help desensitize or help gain control over the panic. So I'd like to give just one brief example, such as you may have post-traumatic stress disorder or anxiety of driving because you were in a big car accident. So what you may do to gain control over the panic is with cognitive behavioral therapy, with your therapist, for instance, just sit behind the wheel of the car with your therapist and think through the situation. Then maybe the next session, you will get behind the wheel, turn the ignition on, but just sit in a running car for a time period while you are thinking through how to drive without anxiety. And then maybe potentially with the next session, you may sit behind the wheel, turn the car on, and just drive around in a parking lot when there is no traffic. And again, this is with your therapist. Of course, this can progress on to the point where now you can drive in a traffic situation in a relaxed state. Now, speaking of relaxed, of course that there are relaxation strategies to help with anxiety, and some of those are related to some biofeedback therapies. Now, one of my very favorite topics, which is really coming with a breadth and body of knowledge and research, is energy work. We are energetic beings. We have energy and vibration that create this network of being, which is the human body. And we are not just chemistry and protoplasm, which is what we used to think, hence the traditional medical approaches focusing on those, which we discussed earlier in the lecture. Again, circling back to the topic of TMS, or transmagnetic stimulation. And for the anxiety conditions, there is deep transmagnetic stimulation, which can get the magnetic waves to penetrate as deep as 4 centimeters under the surface of the scalp. Now, I will say, as a disclaimer, the FDA has approved TMS for depression, but not yet for the anxiety syndromes. Do not forget meditation and yoga as a fantastic focus and relaxation strategy. Acupuncture. And again, as a reminder, the polarity, the meridian, and the chakra work with some experienced providers that are getting some good results. And they should be part of your treatment team. There are some crossover patterns and tapping certain meridians, such as triple warmers, that have been elucidated by such energetic professionals such as Donna Eden to help with relaxation, grounding, and correcting the energetic being that we are. I also wholeheartedly subscribe to sound therapy. And if we think through that, there are ancient origins of this, such as, for instance, shamans beating drums to enter different realms of consciousness. We've had the didgeridoos with Aborigines. And then just simply, even if you, for instance, went into a spa environment, running water and those sounds to help us promote the brain having more of the delta waves, which are those waves that we have just prior to sleep, that actually calm and nourish the brain to take that yang balance we had and create a lot more yin and calming. Do not forget to round out the human body, and the human body likes exercise, again, to help secrete some of the BDNF that we were talking about previously, which is the neurotropic factors to help us grow and help promote our hippocampus, our prefrontal cortices. We need a diet that is calming. So our foods need to be calming, and potentially some tea. We need low inflammation. We need a vegetable-based diet. We need no sugar, and we need to be cautious of caffeine because of its pro-stimulatory effects. Sleep, as always, is mandatory for our brain to rest and secrete the growth hormone for our cellular repair at nighttime. So again, anxiety is pervasive. Most of us have experienced it in our lifetimes, and there are far more treatment strategies other than medications or in addition to medications to help correct our sense of well-being and repair our energetic human existence. I would like for you to share this to all of those who have been experiencing anxiety and could use a little bit more help in a complementary approach. Subscribe to my channel below. Please leave comments and I will get back to you. Give me any more feedback to either this program or any future that you would like to hear. And until we meet again, be well.